So research ethics looks at how these complex ethical issues play out when doing research, particularly on human beings, but also on animals. And over the past 75 years, there have been various scandals when people have treated human beings as guinea pigs. In many ways, the modern consciousness of the problems with research ethics stems back to the Nazi concentration camps, where there were Nazi doctors who did horrific experiments on people. For instance, they wanted to see how long people could survive in the cold before they died. So they forcibly took a bunch of concentration camp inmates or detainees, put them in the cold, and they looked at how long it took before they died. There was no consent. The people did not want to be in the experiment. There are many, many problems with that kind of research. They did other experiments as well, how long people could live before they died of starvation, for instance. And because of those horrific experiences, the Nuremberg trials after the war set up certain basic guidelines on how we should conduct research. Nevertheless, there continue to be scandals. One of the most horrific examples in this country was the Tuskegee syphilis study, in which a group of poor African-American men in the South, many of whom had very little literacy or were illiterate, were studied because they had syphilis. And the problem was that once treatment was developed, penicillin, after the war, the men were not given treatment, nor were they told about the treatment. And the scientists who were supported by the US government wanted to see what the natural course of syphilis was in men without giving them treatment. Now, the problem with that is, of course, that this was not very respectful of the researchers. This was hardly beneficent. It, in fact, arguably did harm. They didn't inform the men about their right to withdraw, what other options are, the fact that the men could get treatment for this, etc. Again, many, many problems with this study, but it increased our awareness of the problems that can be involved when we use human beings as guinea pigs. There have been many other examples. More recently, there have been scandals involving drug companies, for instance, Vioxx, and many other drugs, in which drug companies will be experimenting to develop drugs, and they'll know that there are side effects, and they will withhold information about the side effects in certain cases to people who are who are in the studies or patients who are using the drug. And again, this is very problematic for many reasons. Similarly, tobacco companies, we know very much suppressed information that secondhand smoke harmed people. They had the data and they decided to bury it. Drug companies get involved in other kinds of problems. They will do studies and they will hide negative results and only publish the positive results, or they will report only pieces of the data that show that, for instance, a drug works great at 1 year, but not that it kills people at 2 years and doesn't have any effect at 2 years, for instance. Or they may say, well, it helps middle-aged women, but it hurts middle-aged men, for instance, or et cetera. So there are many problems that continue in our efforts to make sure that research on human beings is done in as ethical a way as possible. There have been problems also with studies on animals. There have been studies that have inserted various things into animals' bodies. The animals suffer a great deal. Sometimes they're not given adequate pain treatment. And of course, research on animals can help our health very much. But we, many of us argue, don't want to treat animals in inhumane ways. And so to find the right balance is important. Another complication is the fact that increasingly drug companies are doing research in the developing world. And there is often much less regulation. Sometimes there's outright corruption. There's often low rates of literacy. And there are many questions about what we owe people in the developing world if we're treating them as guinea pigs. If someone's in a study and the study works, should we continue them on the treatment for life? Should we continue them for 1 year? For 5 years? Who should decide? Who should pay for it? And again, drug companies are outsourcing research, as many other things are being outsourced, but that creates a number of ethical issues that we are interested in training students to be able to deal with, so that whether they're researchers or patients or want to work in rapidly growing institutional review boards, they will have the skills to be able to do this.